Hello and welcome. Today we're diving into a specific type of glaucoma called phacomorphic glaucoma. It's a fascinating and potentially sight-threatening condition, and we're going to explore its intricacies, from its origins to its management. So, let's embark on this journey to understand phacomorphic glaucoma. Phacomorphic glaucoma arises from a significant problem with the lens of the eye. Specifically, it's caused by an enlarged or swollen lens, often due to advanced cataracts. As the cataract progresses, the lens becomes thicker. This increased size can physically obstruct the flow of aqueous humor, the fluid that normally circulates within the eye. In essence, the overgrown lens morphs, or changes the shape, leading to blockage and increased intraocular pressure. The root of phacomorphic glaucoma lies in the mechanical obstruction created by the enlarged lens. Normally, aqueous humor flows from the ciliary body in the posterior chamber, through the pupil, and out of the eye via the trabecular meshwork. When the lens swells, it pushes the iris forward, narrowing or completely closing the angle between the iris and the cornea. This angle houses the trabecular meshwork, the primary drainage system for aqueous humor. With this drainage pathway blocked, the fluid accumulates, leading to a rise in intraocular pressure. This elevated pressure damages the optic nerve, resulting in glaucoma. Phacomorphic glaucoma is strongly associated with advanced cataracts. Because of this association, it's more prevalent in older populations, where cataracts are more common. However, the exact epidemiological data is challenging to pinpoint as it often overlaps with general cataract and glaucoma statistics. Its occurrence varies based on access to eye care and cataract surgery. Regions with limited access to timely cataract surgery may see a higher incidence of phacomorphic glaucoma. The signs and symptoms of phacomorphic glaucoma can be quite dramatic and often present acutely. Patients may experience sudden and severe eye pain, redness, blurred vision, and halos around lights. Nausea and vomiting can also occur due to the intense pressure and discomfort. The eye may feel hard to the touch. These symptoms often necessitate immediate medical attention. Diagnosis of phacomorphic glaucoma involves a comprehensive eye examination. Your ophthalmologist will measure your intraocular pressure using tonometry. A gonioscopy, a special procedure that uses a mirrored lens, will assess the angle between the iris and cornea to see if it's blocked. A slit lamp examination allows a detailed view of the lens and other eye structures. Visual field testing may be conducted to assess for any peripheral vision loss. Optical coherence tomography, or OCT, can evaluate the optic nerve for damage. These tests, taken together, help confirm the diagnosis and assess the extent of the damage. While not strictly classified into types, phacomorphic glaucoma can be categorized based on the severity of the angle closure and the level of intraocular pressure. Some cases may involve partial angle closure, while others have complete closure. The degree of optic nerve damage also factors into the severity assessment. The primary treatment for phacomorphic glaucoma is to remove the enlarged lens through cataract surgery. This eliminates the physical blockage and restores the normal flow of aqueous humor. Before surgery, medications like topical eye drops to reduce intraocular pressure and oral medications to quickly lower the pressure are often used. In some cases, a laser iridotomy may be performed to create a small opening in the iris, providing an alternate route for fluid drainage. However, this is often a temporary measure until cataract surgery can be performed. The best way to prevent phacomorphic glaucoma is through regular eye examinations and timely cataract surgery. By monitoring cataract progression, ophthalmologists can identify and address lens enlargement before it leads to angle closure and glaucoma. Early intervention with cataract surgery is key to preventing this secondary form of glaucoma. The prognosis for phacomorphic glaucoma depends on the duration of elevated intraocular pressure and the extent of optic nerve damage before treatment. If diagnosed and treated promptly, the prognosis can be good, with vision restored and stabilized after cataract surgery. However, if left untreated for too long, permanent vision loss can occur. Recent research is focused on improving surgical techniques for cataract removal in these complex cases, as well as exploring new medications to protect the optic nerve from further damage.